Hi, I am Dr. Legrand, and in this video I am going to talk about irritable bowel syndrome symptoms, also known as IBS symptoms. I will also talk about causes of IBS. I am a naturopathic family doctor that sees patients with IBS on a regular basis and think it's important for people to understand the symptoms to be properly treated. I will talk about 5 different IBS symptoms, common IBS causes, and then towards the end of this video I will talk about the red flags that you should look out for if you think you have IBS. IBS, or irritable bowel syndrome, is a disorder that affects the large intestine. The IBS symptoms that patients will get are, number 1, is that you can have abdominal discomfort, which varies considerably but is steady or cramping in nature, and relieved by defecation or painful defecation. Number 2, you will have alterations in stool frequency. Number 3, you can alternate between constipation and diarrhea. Number 4, it is very common to have abnormal stool passage, such as mucus and feeling of incomplete evacuation. Number 5 is almost always associated with IBS, is bloating and abdominal distension. Patients will be diagnosed with IBS if they fall under the Rome 2 criteria, which is at least having recurrent abdominal pain on average greater or equal to 1 day per week in the past 3 months, with greater or equal to 2 of the following symptoms that we just talked about. The common IBS causes are psychological factors such as anxiety, depression, sexual and physical abuse, and sleep disturbance can all contribute to causes of IBS. Another is physiological factors like altered gut motility and hypersensitivity to pain, which can cause normal digestive gas to be painful for that person. There is also environmental causes such as after exposure of intestinal viruses, bacteria, or parasites. IBS symptoms can also be associated with foods the patient can be allergic to that will trigger the IBS symptoms. But a big portion of that problem has to do with your stress associated with food. Now, I will talk about this more in my next video. Now, some red flags with IBS that you need to keep in mind and need to go see your doctor for are if you have unintentional weight loss, have a fever, if you find blood in the stool, and if you have abdominal or rectal masses. IBS can be complicated to diagnose, but just remember the symptoms, the causes, and the red flags to IBS so that you and your doctor can treat it